Hello everyone and welcome to our final video on the urinary system. In this video we're going to talk about the bladder, the urethra, the differences between males and females, the process of urination, and a clinical connection with incontinence. So let's get started. Now we have made urine in the kidney and now it needs to get out of the body. So the first place it's going to travel to is out of the kidney down to the bladder through the ureters. Okay. The ureters are going to come down and actually go underneath the bladder. So the bladder doesn't fill from the top, it fills from the bottom. And the bladder is just a storage vessel so that when you're able to, you can go to the bathroom and get rid of urine. If you recall from our lecture on tissues, the urinary bladder is lined with a specific type of epithelium called transitional epithelium, which along with the rugae, which are these folds of tissue, help the bladder expand and then go back to its original shape, which is why your bladder is able to fill like a balloon and then go back to its original shape. To help with the process of urination, outside of that layer of epithelium and connective tissue, we have a very specific muscle called our detrusor muscle, which can contract as well as when you have the pressure from your abdomen, push on the bladder to help force the urine out. So here's a view of our bladder. Again, we've cut from the front. This is the bladder itself. Here are the ureters coming in from the bottom and entering here. These ridges you see are the rugae, so they will stretch and go back to normal, and you can see your detrusor muscle right here. This opening at the bottom is the internal urethral orifice. That's the opening to the urethra, and then here's your urethra here, and then the external urethral orifice is what you see on the outside. And then we have our internal and external urethral sphincters, which play a very big role in the ability to urinate. Okay, internal is right here at the base of the bladder, and the external is actually surrounding the urethra as it passes through the pelvic diaphragm in that perineum. So the internal urethral sphincter is made of smooth muscle. So if we think back to what smooth muscle is, it's an involuntary muscle. We have no conscious control over it. The external sphincter is made of skeletal muscle, which means we do have conscious control over it. These are going to be wrapped around the urethra and are going to control the flow of urine out. Now, the urethra is part of what's called traditionally the genitourinary tract, because in males, the urethra is shared with the reproductive system. In females, that is not true. So sperm and urine are going to exit the males through the urethra. Their urethra is longer because they have a penis. And in females, those are going to be separated. So the urethra is not connected to the reproductive tract. Females have a urethra for the urinary system to get urine out, and a vagina, which is going to be connected to the reproductive system. So women, our urethra, females I should say, are shorter, which again is why females tend to have more urinary tract infections. It is a lot easier for a microbe to go up this short path and then create that bladder infection than it is for a microbe to go all the way through the penis, up through the prostate, and then into the bladder. So males that get urinary tract infections, that's a little bit more concerning because it's not as common as it is with women. Not saying that it's not bad when a woman gets it, it's just that women tend to get it more frequently. So UTIs, urinary tract infections, usually caused by E. coli. We talked about that in our previous video. And it's again because in women get them more often because our anus, which is connected to the colon where E. coli likes to live, it can come into contact with the urethra a lot easier in females than it can with males. Symptoms are frequency. You feel like you have to go to the bathroom all the time, and even when you do, maybe not a lot of urine comes out. And when you do go to the bathroom, it's incredibly painful because of that inflammation. Depending on the severity of the infection, you may find blood in your urine and you may get a fever. If it is not treated in time, that infection can come out of the bladder, cystitis, go up the ureters and get into the kidneys, leading to a kidney infection, which is way more serious. So pyelonephritis is a lot more serious than a simple bladder infection. And typically how it's treated is with antibiotics. So how do we pee? We've kind of been building up to this for 2 videos. So urinating is very similar to defecating. It's a reflex. It's not something that we think is a reflex because typically reflexes are thought of as the knee-jerk reflex or when you grab something really fast that's falling. We feel like we have control over defecation and urination. And while that is somewhat true, it's still considered a reflex. Here's why. As your bladder stretches, it's going to send signals through stretch receptors to the brain and spinal cord. And the spinal cord is going to create a reflex that says to the internal urethral sphincter, relax. That is going to cause urine to enter the urethra and hit the external urethral sphincter. That's when we start getting that feeling of, I have to go to the bathroom, okay? The detrusor muscle is going to want to start to contract. And when you get to the restroom, now you can relax the external sphincter consciously because that is our skeletal muscle. So you relax it consciously and you urinate. So again, stretching from the bladder causes relaxation of the internal urethral sphincter. The detrusor muscle starts to contract to push the urine out. You get that urge that you need to go. Then when you get to a toilet, you use the conscious control of your external sphincter to then relax and urinate. And that's how it's supposed to go. Now, incontinence comes in a bunch of different varieties. And all incontinence means is that we don't have control over that external urethral sphincter. I'm going to give you guys 2 different examples of this. First is in children. Right? Any of you that have children or had little brothers and sisters know that potty training is a thing. Because this is a reflex, when children are young and babies, when the internal urethral sphincter opens, so does the external. So they just go, okay? What potty training does is it trains the neuronal pathways to the external sphincter so that they understand when the internal sphincter opens, I don't just have to pee. I have control and can go to a toilet. So that's the process, is you're building these neuronal pathways so that you can go when you need to. Now, what we typically think of as adults when we hear incontinence is usually older adults that no longer have control of that sphincter. And that is definitely a thing that happens as you get older, or can happen, I should say, and it can be due to a lot of different reasons, changes in mental status, loss of that neuronal control, but most common, especially for middle-aged adults, middle-aged women in particular, is stress incontinence. Recall that your external sphincter is running through the pelvic floor, and it is anterior to the vaginal opening. So women that have had a vaginal delivery, basically you stretch that pelvic diaphragm and it's really relaxed and not as taut as it used to be. So without adequate exercises or physical therapy, it is possible to have a weak pelvic floor. And those muscles are what actually help keep the external sphincter closed. They kind of give it some support. So what stress incontinence is when a female has had vaginal delivery or has a weak pelvic floor in general, they cough, they sneeze, or they laugh, the pressure that is caused from those activities in the abdomen increases and it pushes on the bladder. And because the pelvic floor is so weak, the external sphincter doesn't have the support it used to, and a little bit of urine comes out. You don't pee your pants, but a little bit of urine comes out. So that is called stress incontinence. And it's a very common thing that you hear about. Like a lot of women talk about, oh yeah, when you have a kid, this is what happens. It's just what happens. Just because it's common does not mean it is normal. This is definitely something that you should get checked out and get to physical therapy for, because it is not normal. It is common, but it is not normal. So that is it for the urinary system. I will see you guys in our next series, which is the reproductive system. Have a great day. Bye.